Hello YouTube, it is I, Bandedwendy. How are you? It is 5/15/14, Thursday in May. How are you? This is my 6-month post-op tummy tuck with muscle repair, breast lift, and breast augmentation. So back on 11/11/13, I had all those procedures done with Dr. Timothy Katzen, also known as Body by Katzen, a true artist. Totally thrilled with my results, and he, as a surgeon, his aftercare, his bedside manner, tremendous, right? So today I am going there to see him because I have revision surgery scheduled on a breast, which I'm going to talk to you about. And my revision surgery is on June 4th. So totally less all around in every regard than my original surgery. But let's look at the results at where I am 6 months post-op. I want to talk about a couple of things. I want to talk about the revision I have coming up, swelling, fitness, my weight, my shape and size, body image, and sensations in the body. So I'm going to stand up so you can see, but I'm going to keep on talking, okay? Cool. So this is me in my clothes in the morning. I had a lap band fill or an adjustment yesterday, so that has to do with my lap band, nothing to do with my tummy tuck. So I had 5 pounds of skin removed from my stomach. I used to have a pannus, right? And I had 4 inches of muscle separation. So this is my scar. I did have 3 open wounds. So these places where it's bigger are from my open wounds, which is very common in reconstructive surgery. It does happen. I had my drains in for 21 days. And on the 22nd day, I got them out. And on day 23, I walked too far. And then by day 30, I was taking care of my mother at home hospice. So I was lifting too much. So my fault, right? But very, very happy with all. This is typically covered no matter what I'm wearing. Everyone comments on my belly button that 4 inches of muscle separation. He pulled my muscles back together. So, I mean, it's pretty awesome, I gotta say. I'm happy with it, right? So that's the tummy. I use bio oil, and I use something called biocorium, which is a silicone that I get from Dr. Katzen's office on the scars, and I massage them. A couple of places where those open wounds were, where I really didn't touch, have some scar tissue. So they're small little knots, and I have to rub them. Amy Polozzolo, my leader in all this, says I need one of those shower things with the shower head, but we just moved and I don't have one, but my plan is to get one. So everybody comments about my belly button. It's my real belly button. He transferred it, right? So, and I have these lines, and it's good. So then you see, my husband and I have an agreement that I don't show my breasts on the internet. This is one of the Kubi bras that I got. I love the Kubi company. And so I have 400 cc Allergan silicone implants, right? High profile. And I used to be a 44 triple D before I had weight loss surgery. Then I got down to a 34A. I am now a 34. Okay, part 2 because I got cut off. Okay, so now I am now a 34 double D. And so because I had my implants under the muscle, right, this boob, if you notice, it sits a little bit lower. And what has happened is, and I don't have any scars, right? I had areola banale incision. It's gorgeous. Had full sensation 4 days post-op. Everything has been fantastic, except for I have this breast implant that has dropped below the muscle. So this boob, I had a cyst, a 4 centimeter cyst removed. I think the scar tissue helps. Why does the implant drop below the muscle? The answer is multitude of things. Could be anything. Could be excess skin, not having too much, the implant not being big enough, that maybe I should have picked a bigger implant, not interested. Because I had such large breasts before, I'm not filling up all the skin that I had left. Two, elasticity. Because I had lost so much weight, my skin has lost its elasticity, so it just kind of fell. Number three, what is the third one? There was a third one, but not one that I'm remembering right now. Either way, I'm getting it fixed. So Dr. Katzen's going to go in, and it'll come up. So it'll actually be even, and he's basically going to stitch a shelf in there to, because this breast basically has no crease. See, that's the implant. I can push it up, right? Where this one, there's a crease, right? You see that crease? This one doesn't have a crease. It's coming down. So basically he's going to fix it. It's like a 40-minute procedure. He's charging me nothing, which is good. I just have to pay for the facility, surgical center, and the anesthesiologist. So, but my mom and I both agreed I need to have perfectly perky. So this is something that I've been dealing with since December, really. So anyway, we're going to get that fixed. And so, yeah, so, you know, I'm happy with the boobies. I wear a bra 24/7, some kind of bra. I sleep in a bra now. Basically, the only time I don't have a bra on is if I am showering or having sex, basically. So what do I want to talk about? I talked about the revision. I'll let you know how it goes. Swelling, I'm doing this video first thing in the morning because that's when I feel my best, I look my best. I still swell. I just this week stopped wearing it, but I've been wearing a compression belt for activity, for fitness. Whenever I do fitness, I wear it, or I run, I do strength training, or I do Pilates or yoga or push-ups. A lot of that is abdominal work, and I'm told not to do abdominal work, so it helps. If I don't wear it, I swell up so quickly. Based on what I eat. Anything with high amount of sodium, I swell up, I bloat up. Even sometimes just eating in general, my stomach gets really, really tight. So it's a new sensation. It's something, those sensations are nothing I felt as a weight loss surgery patient, as a regular human being walking around. I didn't feel it. Only do I feel those things post. I'm going to see if I can turn you around. Do I feel those things post reconstructive surgery? So I'm in my bathroom. I'm trying to get it so I'm kind of looking at you. Okay, the other thing, fitness. So for me, I had 8.5 weeks off from fitness. When you get those open wounds, there's no type of fitness. So I wasn't even walking. And that really knocked me down, being cut in half, being sewed back together, being fluffed, nipped, tucked, and fluffed. And then taking that 8.5 weeks time off. And I think even maybe being in the cold of Ohio, I don't know. But that whole situation, 4 months pretty much of not being in my regular space, physically or mentally, with this surgery, changed fitness for me. And so, you know, I came back in January, did couch to 5K 24 days in a row, and got back up to the ability that I could move for that period of time. My speed hasn't came back. I still have discomfort or, you know, pull in my abdominal area when I'm running. It's been challenging mentally to, like, I feel like it's so 5 years ago where I am physically. I know that's not true, but that's how I kind of feel because I like to go fast. I can't go as fast as I used to go. I'm not giving up. I'm still working on it, but here I go into 5 more weeks of no fitness post revision surgery. So I'm kind of giving myself until June of next year, 2015, to be whole again. I moved up into the mountains. There's a huge triathlon that goes on. I can't do it because I'll only be 4 weeks post-op. But the truth is, I can't swim. Was in Florida on a cruise. Both times I tried to swim. It's too much discomfort in my abdominal area. So fitness is different. Yoga is hard. P90X, there's certain things I can't do because it's just too much discomfort. My weight continues to fluctuate. Dr. Katzen told me 3 months ago it's not swelling. I finally now have my full CC back. I had 1 CC taken out of my lap band, and I did put on some weight post-reconstructive surgery, 13 pounds. I pretty much got all that off, but a couple of pounds. But I feel like I want to go thinner. That's just me. I'm always chasing the thin figure of myself, which I like that. It keeps me excited about doing stuff. So, but the weight, myself and a multitude of people that I'm surrounded by have all had at least a 10-pound weight gain since reconstructive surgery. Even if they lost weight post-surgery because of skin removal, which I did not, but they've gained some weight. So it happens. It's just everything. It's a whole process. And I don't really know that I've heard too many people in the community talk about that. My shape and my size, I have a butt, I have curves, I have boobs. The boobs to me, because I was a 44 triple D moons ago, they seem very normal and the right size for me. I don't really notice them at all. Every once in a while in a shirt, I'll be like, oh, you know, but I'm still wearing my extra smalls and my small shirts, so they just are more fitting, and I like that. I love my flat stomach. This butt thing is new for me. I'm thinking if I lose 10 pounds, maybe the butt won't be so new, but my husband loves it. I just like a slim me, but I am embracing the curves. And it's fun. It's fun. I mean, I'm totally happy with everything, the way I look, the way I feel. You know, you can't go wrong with it. I have no more berry belly, you know. And the boobs were fine before, in my opinion, but now they're just better, you know. Sensations, just everything. You know, my port, I still feel numb. Dr. Katzen said I may never not feel numb in certain spots. My breast, you know, a lot of sensation there. Laying on my stomach or laying sideways sometimes is not comfortable because of the implants, so I choose not to do it. Again, certain moves or positions, straightening my legs or laying on my stomach or running really fast or doing a plank or doing a push-up or anything like that that's abdominal driven still is not, it feels different, and I don't like the way it feels, so I prefer not to do it. So anyway, now this video is getting pretty long, but I hadn't done an update for a while. If you have any questions about Dr. Katzen or about reconstructive surgery, tummy tuck, with muscle repair, breast lift, breast augmentation, which is implants, let me know. Yeah, the fitness thing is really a big one for me, and I think for anybody who is as active as I was. If you're going to be shut down for any period of time. I actually looked forward to it at the onset, but it got to be too long, and it's hard to come back. It's not hard to come back mentally from the place of wanting to do it, because you're an athlete, you know, you like fitness, you're an addict, maybe, you know, that's your thing, it makes you feel good, it makes you look good, it's your lifestyle, and it is who you are. So a little break is nice, but when you used to be able to push the treadmill at 6.6 and start running, and now you're like, oh, 6.0 is as fast as I'm going to go, and it's going to be a workup to get there. It's kind of like, not the same, if you know what I mean. Anyway, onward. Hope you're all doing well. Thanks for watching. Bye.